So today we're going to be talking about scheuermanns disease. I'm Andrew. So our objectives today is to discuss the 3 dysfunctions that may be associated with scheuermanns disease and provide supporting interventions to address these dysfunctions, and also provide an explanation of the supporting interventions. So the dysfunctions that are associated with scheuermanns disease would be postural deformity, decreased hip flexion due to tight hamstrings, and a decreased flexibility. So our first one we're going to talk about is interventions to address postural deformity. So there's kyphosis usually associated with the scheuermanns disease. This results in like rounded shoulders, which will shorten muscles such as the pec major and pec minor, but it will also lengthen muscles such as the lat straps and rhomboids. So for my max protection phase, I included soft tissue mobilization of the pec minor and major and prone gentle back extensions. I didn't include anything due to the forward head posture that would be associated with this, but you could also do soft tissue techniques on the cervical muscles that would be shortened with that, such as the cervical flexors. So I'm just gonna show we'll just do the prone gentle back extensions. Okay, so I'm gonna go let her lay prone. Get on our elbows and just kind of push up from the plinth. Okay. That will kind of strengthen and lengthen the back extensions while also opening up the chest. And then for the pec major minor, usually with the rounded shoulders, that's going to be shortened, so a soft tissue immobilization of those muscles will help that. For the moderate protection phase, we have a pec major minor wall stretch, which is the same kind of concept, just working on the muscles that are shortened. And then a horizontal foam roller thoracic extension. So for this one, just roll back and forth. It's horizontal.
Am I doing this one?
Yeah, come this way. Like go back on. Yeah, no, stay. So this will work on the back musculature. So this will work on the soft tissues of the back that may be affected by the kyphotic posture. And then for the minimum protection phase, we have banded rows and banded IYTs. So for this one, this improves the back musculature and the endurance involved in it. So we can just do the rows. So row back, try to pinch those shoulders back. You go. And then the IYTs with the band, just IYTs, and the IYTs will open up the chest, so it'll be working the pec minor and pec major eccentrically on the way back down or the way up, and then it'll also work the back musculature concentrically. And then my next intervention would be to address decrease in hip flexion, which will be secondary to tight hamstrings. So with this, I added the transverse soft tissue manipulation of the hamstrings and the seated hamstring stretch. So we'll just perform the seated hamstring stretch. So with this one, just want to kick your foot forward and lean into it. Really feel a stretch from it though. for the moderate protection phase, we'll utilize the foam roller again with a hamstring stretch, and then the hamstring chair stretch, which we'll just do the foam roller. One bent, so just put it on there. And then ask him to roll back and forth on it. Try to,
Roll my body.
yeah, roll your body forward onto, yeah. So it's kind of like a soft tissue manipulation of the hamstrings. Try to release the tightness with that. Okay, good. Okay, and then for the minimum protection phase, we got prone hamstring curl with band and a single leg glute bridge. So we'll just perform the single leg glute bridge. So this is working on the glutes, the hamstrings, and we're also working on the abdominal muscles. Okay.
Alright, now we're going to talk about interventions to address decrease thoracic extension and rotation. So during the max protection phase, we can do cat-cow stretch, pelvic tilts, and open book stretch. For the cat-cow stretch, we already seen that earlier, but that's just gonna help mobilize the thoracic spine by encouraging flexion extension and reducing stiffness without having excessive strain. Then for your pelvic tilts, that's just engaging the core to improve pelvic control and stabilizing the spine. And open books is gonna increase spinal rotation, which can be restricted due to the kyphosis. So we'll just demonstrate the open books. Go in. Have your knees bent towards me, or towards that side. Arms straight out in front, and you're just gonna open up. Scoop that way so you can. Yes. Let your eyes follow your hand. During the moderate protection phase, we can incorporate thoracic extension over the foam roller. I did that earlier. We can also do quadruped T-spine rotation and downward dog. We're gonna go ahead and do the quadruped T-spine rotation, which that's just gonna further enhance mobility of the spine and rotation. So, you will get the quadruped position. Put your fingertips behind your head. You're just gonna go down and open back up. Let your head fall. Good. Then for our minimum protection phase, we wanna do exercises that's gonna relate to function. So we have prone swimmers, lunges with T-spine rotation, and wall angels. So the prone swimmers is going to make sure our patients keep an upright posture, and it's gonna help with prolonged standing and walking. Lunges with T-spine is going to help mimic walking, running, and stair climbing, while also controlling spinal rotation. Then the standing wall angels is just going to help our patients stand tall, walk more efficiently, and reduce the slouch posture. So for our prone swimmers, can you lay prone, please? You're gonna do opposite hand, opposite leg. So raise your left arm, your right leg. Okay. Then for the lunges with T-spine, I want you to lunge, and you're gonna open up to the side. Make sure knee is bent.
Sorry, let my knee.
Yes. So lunge, and then open up to the other side. There we go. All right, and then standing wall angels. Let's go on the ball. Start in this position, knees bent slightly. And you're gonna go up, go back down. Make sure you feel your shoulders retract, or your sacral retract. overview, Scheuermanns disease can cause various dysfunctions that significantly affect a patient's functional abilities. The main goals for the interventions we discussed include improving posture, flexibility, and strength. And these are resources. These are the pictures.
Any questions?
Yeah, I know. What if the foam roll situation was too much for her? What else would happen?
If the foam roll for just any
When she was laying back on it, like what would that cause too much irritation?
for the hamstring.
No, for the extension. You do it too, but you can sit in the chair, have them do extensions in the chair instead of the foam roller. Any other questions?
What would be the difference from a row with the hands like this and then what you did like this?
You wanna answer?
What was the question?
What would be a difference in the rows with your hands like this versus your hands like this?
With it more in, you're working more rhomboids, middle traps. I guess outside would work more. You probably engage more post dip, but it's around the same restriction.
Gotcha.
What joint mode would you do to help correct a forehead posture?
Ooh.
In conjunction with your forehead?
The OA unilateral nod, because with the forward head posture, you would be limited with the calf flexion. So that would help with the forward nod.
For the prone swimmers you did, how is that, can you describe to us kind of how that's functional?
So you're gonna incorporate your upper body in your lower body, so that helps with coordination with that. It could also mimic like if a patient needed to reach overhead, if they had to lift something, if they were at the grocery store, they needed to pick something off the shelf, they were at home, they needed to get something off the shelf. So, yeah.
Also get translate to swimming.
Anyone?